I would say it is critical that we look at the programs that support our safety net healthcare providers like the 340B, but we can't have this discussion without also talking about how so many of our hospitals and health centers that families really rely on are facing an existential threat from the massive healthcare cuts that Republicans passed earlier this year. In fact, we are already seeing those closures. And they're going to face even more pressure if Republicans refuse to just work with us to save the ACA tax credits and stop those premiums from skyrocketing and prevent millions of our families from getting priced out of their insurance. So as crucial as this 340B program is, I do have to say I am deeply frustrated that this committee is actually ignoring the elephant in the room on health care right now. My Democratic colleagues and I have been pressing for action on this for months now, but we have not had a hearing, we haven't had any talks, and no real serious interest from Republican leaders. Now, open enrollment starts next week, and this committee has yet to hold a single hearing on the fact that premiums are going to spike for 22 million plus people who rely on those ACA premium tax credits. We are talking about 5 million people in this country getting priced out of their insurance entirely and going uninsured. This is not some distant issue. Window shopping has started already, including in my home state, and I am hearing from a lot of people. Families are already logging in, and they are facing sticker shock and wondering, how on earth am I going to be able to afford this? I talked to small business owners. They are really worried that they're going to have to close their doors or just give up their insurance entirely. I've talked to seniors not quite eligible for Medicare who've been told their premiums will jump by over $1,000 a month. And I know this is not just a crisis in my state. This is happening across the country. And most of the people who actually rely on these tax credits live in red states. 4.5 million live in Florida, 3.7 in Texas. Louisiana has over 250,000 people who will be impacted. And their premiums are on track to more than double. And so many of them will simply not sign up, lose their coverage, and forego care. We also know that's going to lead to job loss, an estimated 340,000 jobs in the country in the healthcare space. So it is frustrating to me and baffling that with the health care for millions of people on the line, this committee has not yet held a hearing on this issue. And I just have to say, ignoring this problem is not going to make it go away. So I just want everybody to know we're going to keep pressing to work with our colleagues across the aisle. We've been asking about this for months. We've been at the table for months. We've got to get this work going now before those high premiums are locked in, and every day makes it much harder. So having said that, I do have some questions for those in front of us. Dr. Feldman, I want to talk to you because you are a critical care physician, I understand, and a pulmonologist. We're talking about 5 million Americans becoming uninsured because of this failure to extend the ACA premium tax credits. When people become uninsured, what do you see as a physician that patients skip out on, and what does it mean for their health?
What I see is that patients skip out on doctor's visits, patients skip out on medications. I vividly remember seeing a patient in the ICU last year who was there in diabetic ketoacidosis, DKA, which can be a fatal complication of diabetes. Why? Because she couldn't afford her insulin. So I think people losing their insurance will have very real consequences for patients across this country.
Yeah, I talked to some providers in a very rural part of my state a week and a half ago talking about with all this uninsured that they will see, especially in our rural communities, it is going to have a real impact on providers, on hospitals and doctors, and we're going to see more of them not be able to provide the care they need because that they get the care eventually, but usually when it's more expensive and they provide it uncompensated. So I wanted to ask you, as a physician and a researcher, what happens to our safety net providers and hospitals when Americans go uninsured, from your perspective?
The safety net providers get stretched. When patients don't have insurance, hospitals, community health centers are providing more care without reimbursement, and it only makes their jobs that much harder.
Yeah. Thank you. Thank you very much, Mr. Chairman.